Hi, you guys. Welcome back for our daily practice questions. It is day 206 and our Pharm series continues. But as always, I like to first start with my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock, a family nurse practitioner and the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, digital flashcards, Q banks, one on one sessions, and more to assist nurses as well as nurse practitioners with success on the boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. But y'all know my disclaimer and reminder is that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AANP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. But before we get started, don't forget to hit the subscribe button so you're not missing any of my videos. And if you would like to gain access to my NP Test Success Toolkit, it is free and linked in the description. My website is also linked in the description and it houses all of the resources that I offer. Also, if you're looking to gain access, I have 2 spaces remaining for my upcoming 5-week intensive review. Class runs from August the 11th through September 12th, and the link is in the description to enroll. All right, you guys, question number 1. A 14-year-old swimmer presents with ear pain and discharge. On exam, the tragus is tender. What is the best treatment? Is it A, oral amoxicillin? Is it B, Cipro and dexamethasone eardrops? Is it C, oral ceftonir? Or is it D, hydrogen peroxide ear irrigation? Take a moment and tell me what you got, y'all. All right, y'all know I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what is being asked of you. So here, the stem of the question states, what is the best treatment? And when we're talking treatment, I always tell you to run it back and look and see if they provided you with a diagnosis. And if they have not, then you need to run it back a step further and look at the assessment findings so that you can determine what it is. So here, a diagnosis has not been provided. So we're going to run it back and look at the assessment findings. It shows a 14-year-old swimmer presents with ear pain and discharge. And on exam, the tragus is tender. Now, y'all are probably familiar with this question in a different format, but y'all, this is classic presentation of otitis externa, and I'm trying to show you in different fashions so that you are able to pivot no matter how they direct this to you, because these are different style questions to gauge that you're able to assess appropriately, looking at signs and symptoms, the patient's presentation. And remember, tragal pain, tender tragus, is a key identifier for otitis externa. Swimmer's ear, this is a swimmer, ear pain, discharge, etc. So otitis externa, the best first line treatment option is your B, your Cipro, plus dexamethasone ear drops. Question number 2. A 38-year-old female is diagnosed with primary hypothyroidism. TSH is 12.3, and she has symptoms of fatigue, cold intolerance, and weight gain. What is the most appropriate treatment? Is it A, levothyroxine 50 micrograms daily? Is it B, methimazole? Is it C, refer to endocrinology? Or is it D, no treatment unless TSH is greater than 20? Take a moment and tell me what you got. All right. Stem of the question states, what is the most appropriate treatment? Again, look to see if they have provided you with a diagnosis. And they have let you know that the patient has been diagnosed with primary hypothyroidism, has a TSH of 12.3. So what would you do in those circumstances for treatment? And the best treatment option is A, levothyroxine 50 micrograms daily. Now, you're probably wondering why we didn't go with our standard 25 micrograms, but that is initial treatment. This is somebody who already has a diagnosis of primary hypothyroidism and her TSH is at 12.3. Once you have a TSH of 10 is when we initiate therapy. All right, and lastly, question number 3. A 26-year-old female complains thin gray vaginal discharge with a fishy odor. Wet mouth shows clue cells. What is the recommended treatment? Is it A, oral metronidazole? Is it B, oral fluconazole? Is it C, ceftriaxone IM? Or is it D, clindamycin oral? Take a moment and tell me what you got in the comments, y'all. All right, so stem of the question here states, what is the recommended treatment? All right, so again, we're going to look to see if there's a diagnosis, and there's not. So let's run it back and check out the assessment findings. We have a 26-year-old female who complains of thin gray vaginal discharge with a fishy odor. Y'all, this is already classic and key identifiers for BV, bacterial vaginosis, and also confirmatory is wet mount showing clue cells. That's another key identifier. So now you need to remember what your first line treatment is for BV, and your best answer is A, is your oral metronidazole, aka Flagyl. I always say think F and F, fishy Flagyl for your management. All right, y'all. I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whoever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any other resources that I do offer, feel free to reach out to the nursing studio by giving us a call. You can also shoot a text message to this number or shoot us an email to thenursingstudio, the number one at gmail.com. Everything that I offer is linked in the bio of this channel, including my website. And as I mentioned previously, my website is also linked in the description of this video, and it houses everything that I offer. All right, y'all. Y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.